traditionally, clinicians have not really thought that surgery played a role in the treatment of patients with metastatic disease. But now there have been numerous studies from large databases like the National Cancer Database and also from large single institutional databases suggesting that when patients with metastatic disease undergo surgery for treatment of the primary tumor, that patients have improved survival versus those who don't have surgery and just receive systemic therapy. So one of the questions has always been what should be the timing and which patients would really benefit the most. So the thinking in the past has always been you just do surgery for palliative measures. So patients who have large tumors that might be ulcerating or causing other issues in terms of pain and symptoms for the patient, that maybe surgery plays a role at that point. But that's just a palliative measure. And so now the thinking is that with these studies that have demonstrated improved survival, that perhaps surgery should be utilized, and the question is when. Should it be at the beginning, before any systemic therapy, or should it be after systemic therapy has been introduced? And so there have been a number of randomized trials and from different countries, also one in the US, that have asked that question. When patients receive systemic therapy, then have surgery, is there improved survival over those who don't have surgery? And so some studies have shown there is improved survival and some studies have shown there isn't. And I think part of the issue is that the patients are very heterogeneous that have been in these studies. So we haven't really looked at breast cancer subtypes and understood the systemic treatments for each subtype and then how surgery plays a role in that setting. We've also had very heterogeneous patient populations in terms of the number of metastases that are present, the sites, bone versus liver versus brain and other sites. And so that's created some confusion as well. So it's difficult for the physician in practice and for the patient to really know when surgery is going to benefit them versus just doing systemic treatments. Those studies are ongoing. The ECOG trial has completed enrollment, so that's the US trial of randomization of surgery versus no surgery in patients who have systemic therapy first and have some response to therapy. And so we're waiting the results of the ECOG trial, but in the interim, we still have questions, and it has to be done in a shared decision-making fashion. It has to be the patient and the physician working together to try to discern who's going to benefit. There's also a question about the role of surgery or ablative therapies for patients who have metastatic disease. So surgical resection of the metastasis or stereotactic radiosurgery for that metastatic lesion. And so there's also an ongoing trial through the NRG looking at the question of stereotactic radiosurgery for patients with metastatic disease versus surgical resection for different sites of metastasis.